Welcome to Chats with the Chief. I'm John Jensen, Chief of Staff at the Veterans Health Administration, and this is the podcast where we make small talk about the largest integrated healthcare system in the country. This week, I'm joined by Dr. Eric Schoomaker, VHA's Whole Health Advisor and Army veteran. We'll talk about how the VA is moving on from what's the matter with you to what matters to you. Enjoy the show. Well, Dr. Schoomaker, thank you so much for being here. Thank you for joining us and taking the time out of your busy day to talk with us today. And we want to try to share with our audience a little bit about you and a little bit about Whole Health and what you've been working on, et cetera. So maybe you could start by telling us a little bit about yourself so that everybody can kind of get acquainted with you.
Well, Chief, first of all, let me just thank you and your whole team for allowing me to do this. This is a special privilege, and I think as I get longer in the tooth, I recognize more and more how much of a privilege it is to get in front of people, a team as talented as the VA is, and veterans especially, and their families. And we're so beholden to everybody who has served in uniform in any capacity. And, I'm a strong believer that we made a difference over there, and we'll continue to make a difference over there. Some of my proudest moments in uniform were seeing what we did to help the Afghan people.
Yeah. And that was we done throughout the world, my time and your time in service as well.
Absolutely.
Yeah.
So I'm Eric Schoomaker. I'm a retired senior medical officer for the Army. I was privileged to serve in my last assignment as both the Surgeon General of the Army, the primary advisor on health matters for the Chief Staff of the Army and the Secretary of the Army, as well as the Commanding General of the United States Army's Medical Command, which is all its fixed facilities. I think as many of your folks know who are themselves veterans or have been working with the military for a long time, the military health system has about the same number of beneficiaries, reliant beneficiaries, as the VA does, about 9.5 million, and the Army, Navy, and Air Force are the principal health providers. And I was responsible for, as a commander, for all of the fixed facilities and preparation as a force provider for any OCONUS operations, while also running units in Europe and in the Pacific. So I come to that. I'm a member of a multi-generational military family. My father was a veteran of 3 wars, the World War II, Korea, and Vietnam. My older brother was a senior officer, served as a special operator for most of his career, and then went on after retiring to be recalled to active duty, something that everybody out there who's a retiree needs to remember, that you can be recalled.
That's right.
At the discretion of the president. Yeah. He's recalled and served as a Chief of Staff of the Army while I was in uniform. And since retiring, I decided to go back to my roots as an academic and a researcher, and went to Uniformed Services University up in Bethesda, Maryland, the only federal health university that we have that trains about 25% or more of the Army, Navy, and Air Forces and Marines physicians and graduate nurses and dentists, graduate dentists and public health officers and scientists. And worked on leadership, co-edited a textbook of military medicine, and worked for a very long time following up the work that we did on pain while I was on active duty. And it's really through those relationships that I became familiar with the VA. I mean, truth be told, and there might be people out there that remember when I was a medical student at the Ann Arbor VA and a resident of the Durham VA, but I've been in touch with VAs throughout my career. We're very privileged in the active force to be partnered almost in every installation that I ever served in, whether it was Fort Gordon, Georgia, in Augusta with the Charlie Norville VA, which is a phenomenal institution, the Audie Murphy VA down in San Antonio. We had a partnership in Colorado. I mean, every place I worked, really, including Walter Reed, when I commanded Walter Reed with the Washington VA. We've always had great relationships with the VA. And of course, we're the left hand of the right hand that is joined for every veteran and family who transitions out of uniform, and everybody eventually does, hopefully and safely. So our partnership with the VA has always been critical. I became familiar through the work of Dr. Tracy Gaudet, with Whole Health going back almost a decade now, 7 or 8 years. And when she got ready to leave to go into the private sector a couple of years ago, a close friend and fellow General Officer Rich Stone, who just departed from serving as the acting Undersecretary for Health, asked me if I wouldn't come in and assist in Whole Health, knew that I was very enthusiastic about what was going on, and of course I jumped at the opportunity. And Chief, you were instrumental in helping me get on board, and I appreciate that.
You bet.
I've been working with Dr. Ben Kliegler and Dr. Cynthia Gant, Senior Nurse Officer, former Afghan, actually naval commander in Kandahar herself, for the last several years, on this incredible program. No, not a program. And I have to punish myself for using that word. This is nothing more than a fundamental transformation in how we think of health as a even larger and more comprehensive notion than healthcare itself. Healthcare, as many of us know, and now numerous studies have documented that healthcare is just one component of a larger, comprehensive notion of our health and our well-being. Quantitatively, healthcare contributes about 20 to 25% of that. But the rest of that, what makes you and me and all of us either satisfied and imbued with a sense of meaning in our lives and a sense of fundamental health and well-being, are things like, how is our family doing? How are we integrated well or not with the community? Are we employed? Is that employment meaningful for us? Are we at a level of education that we aspire to be? Are we nutritionally competent and feel that we are in good shape? And obviously, very important, are we spiritually sound and grounded? And is our mental health, is our sense of our relationship psychologically to both ourselves and the community and others intact? And all of those things contribute, quite frankly, Chief, more importantly and more strongly to this notion of health and well-being. And that's what the Whole Health program does. The Whole Health program, the system transformation looks at all the programs that are out there, each of the individual components of financial literacy, of educational promotion, of disability adjudication, all of those things that the Veterans Administration provides for the individual veteran and for their family by extension, and says, are we doing best by you? Are we achieving what you as a veteran want to achieve to make your life meaningful? I think there's a great introductory paragraph on the website for Veteran Whole Health that says, we've moved from what's the matter with you to what matters to you.
Yep.
And what I liked about this so much, and why Dr. Gaudet and now Doctors Kliegler and Gant and the whole group at the Office of Patient-Centered Care and Cultural Transformation, who have kind of oversight, the midwives, if you will, in the VA system for this whole health transformation. What I really relate to is, as a veteran myself, and as one who worked all of my career to ensure that soldiers, sailors, airmen, Marine, Coast Guardsmen, and civilians who are in the Department of Defense, whose focus at that time, your focus as a former soldier, was what was meaningful to the Army, to our uniformed service, to ensure that we were ready to serve the nation. So that concept of what was meaningful to us is there when we're in active duty. And so when we transition to the VA, it's not much different in that, except that now the focus is on what matters to you. What matters to you to make you effective, not to defend the country any longer, but to be a great citizen, to be a great father, to be a great community member, to be a teacher, to be whatever you are, to be a fisherman, as I just got through vacation fishing. Whatever matters to you, how can we, as the entire system rally behind what your needs are. And so that's got to start with you as the individual. And I say to my colleagues who are working in this Office of Patient-Centered Care and cultural transformation, this is truly a cultural transformation. But those of us who've been in uniform, this is familiar to us. There isn't an individual enlisted soldier or young officer who doesn't know what they need to do to get to that next step, or to be ready ready to deploy, or to go to ship, or to serve on a tarmac. They know that, and what we're doing is basically saying to them, hey, that hasn't changed for you, but now, young new veteran or old former veteran, older veteran, what's meaningful to you, and how can we help you with that?
Fantastic.
Long explanation, I apologize, but I wanted to get there.
Fantastic. Well, I think you can see the passion that you have for whole health and really for the care, the holistic care of every veteran that we see and have the privilege of being around.
And I really appreciate the opportunity to kind of clarify that. A lot of people misunderstand that, I understand whole health is this new introduction of complementary practices, yoga and acupuncture and guided if that works for you, that's part of it. But if you are in a conventional diabetic program, that may not be part of it. And if you came out of the service, as I was privileged to do, fairly intact and healthy, then maybe it doesn't have to be healthcare focused at all. But at the same time, and I'll speak to this if you're interested, when you make that transition, and you, Chief, you may have experienced this yourself, you don't really anticipate what changes are going to occur that are deep in your soul, deep in your psyche, that emerge after this. And events like this last week, and seeing images coming out of Kandahar and Bagram and Kabul, kind of reinforce the fact that, wait a minute, we've got a lot of hidden baggage in there that may emerge at a moment. And guess what? The VA is here for you. The VA is here for you, starting with your fellow veterans.
Which is the key about the system, is that it's veterans, caring for veterans in many cases, but also the veteran community surrounds our veterans in times of need, and always will. One of the things we try to do is just to get to the audience, to get to know our panel a little bit better, is to ask a couple kind of maybe simple questions. But so is there a book, movie, or TV show that you're reading or watching that others would be interested in?
I just last night saw, the 4th episode of Ted Lasso. If you haven't seen, have you seen Ted Lasso?
No, I'm not.
Everybody ought to plug in and watch Ted Lasso. Ted Lasso is just a terrific streaming TV program, and I'll tell you why you should watch it, particularly, Chief, from my perspective, because it's about leadership. I mean, I'll give you, without spoilers, I'll just give you a real quick summary. Ted Lasso is a Kansan. He's a former football coach for a second, third tier football team, and he and his buddy, his assistant coach, are hired by a wealthy divorcee to come and manage an English football team that is a soccer team. He doesn't even know how the game is played. He knows none of the terminology. He calls it practice when they call it training. He calls it cleats when they call it kit and boots, and he has no idea what the rules are, but he knows how to lead. Management, the details, the jargon, that's a management issue. He's a leader.
Interesting.
And he creates vision. He has enormous emotional intelligence and can see where the strengths and challenges for his players and the players' significant others are, and he can relate to them. And it's very, very entertaining. So I would say, if you haven't seen Ted Lasso, and Truth in Lending, I get nothing for. And then the other thing I just finished this book, Robert E. Lee and Me, and I just brought it along just to show people. It isn't a big book. It's small. If I can read it, anyone can read it. This is a compelling book. This is written by the former chairman of the Department of History at West Point, at the United States Military Academy. Ty Seidel, and he is now a retired brigadier general. He's on the commission to rename Army posts away from former Confederate leaders and sympathizers. But he himself was born in the South and raised in the South, Alexandria, Virginia, across the way, and other towns throughout the South, and then went to Washington and Lee University. And what he talks about here is he reaches a point not too long ago where he realizes that much of what we know about the Civil War and the events following that, to include the erection of these statues, was based upon false history.
Yes.
And he goes back as an historian and in wonderful detail, and it's heart-wrenching to listen to him have to face his own mythology about the man Robert E. Lee, but also the entire context. And I'll tell you, I came away from reading this book with a much greater understanding and appreciation for racial disparity in this country, economic disparity that has resulted from racial disparity. I mean, many of us, how is it that in my 8th decade of life, I'm only now learning about the Tulsa Massacre?
Yeah, no,
I lived in Oklahoma as a kid, and yet I never knew that.
Right.
He talks about how did this happen? What disinformation campaign that took place, this rewriting of history, of textbooks in the South and elsewhere, the efforts that were made to kind of gloss over the fact that this war was fought over slavery. It continued to be fought over slavery even after the war ended, and it resulted in a resurgence of what's known as the lost cause myth, that claimed that this was really not about slavery. This was not about indentured, brutal system, economic system. This was about Southern states' rights, and he explains that in such incredible detail. I think everybody ought to know this as an American. Everybody ought to read this history.
I look forward to reading it.
Yeah.
Thanks for sharing that.
Sure enough.
That's great. Both of those are great. And I wrote down Ted Lasso too.
Ted Lasso.
That'll be something I'll be watching tonight for sure. You've been around a lot of different areas and done a lot of different things. Is there a lesson or a piece of advice you've ever gotten that you kind of never forget, fall back on all the time, or want to share or continue to share with people?
Yeah, first of all, I think it will surprise many people that I'm a very strong advocate and adherent to mindfulness, to the notion of establishing ourselves in a place where we appreciate the moment, that we aren't dwelling, as our minds are designed to do, in the future, often catastrophically, or in the past, often with regret or grief, but rather enjoying and understanding the moment. I spent so much of my time, and I'm sure this was true for you, Chief, knowing what jobs you had, that you're always over the horizon. You're always anticipating this. You could very likely right now be sitting here thinking to myself, when is this guy going to quit talking so I can go and work on the markups on the Hill? I mean, that's how we are.
Yes.
And it's not against you or me, it's just how we are. It's how we're built. And yet, what that does for us is it takes away from our effectiveness in the moment. And now this is being studied very thoroughly. It's being taught now. I'm part of a program, I'm privileged to say, with a prominent neuroscientist at the University of Miami, Amishi Jha, and her colleagues, teaching the Army how to do this formally. Senior leaders in the Army and in the military in general have recognized that this is something that can help focus the individual in uniform and again, by extension, their families. It increases working memory, it increases the retention of information, and it increases their attentiveness. And there's evidence now that if taught to those before deployments, it reduces post-traumatic stress disorder. This ability to focus through meditation or through other things, and some of us do it through exercise, through yoga, other things, but I'm a very strong proponent. I think another thing that I learned very early in my life, and I was glad for that, since we're talking about careers, is, and I often had young officers come to me and say, I want to be a Surgeon General. What do I need to do? And I would say, you do the job you've got.
That's right.
You do the job you've got.
Right.
We're always looking for people who make more of the job they have than we thought they could do. And I had a mentor when I was in residency down at Duke. Actually was in the VA hospital at Durham, VA. And I said, his name is Jerry Logan. I said, Jerry, your career, you were even in the active Navy at some point, and I'm going to go in the Army. What could you tell me about how you charted your career? And Jerry laughed and he said, hey, listen, my career is coherent only in the rearview mirror.
Yes, it is. That's a fact.
You're going to plan, but that's just so you're comfortable going to sleep at night. The fact is, follow your passion, follow your interests, and it works out over your lifetime. And I would have to say the same is true for me. I don't think I ever. As my mom and dad would have told you, I'm probably the last person anyone ever thought would be a general officer in the United States Army, or that I would even serve longer than my ROTC obligation. I got into the Army with a very strong intent to go back into academic medicine, go back to a Duke or a Michigan and do research and practice medicine. And yet I found when I got into the service, what an incredible group of people we work with. What a talented and committed group. Mission focused, selfless in their approach to things, community oriented, and it became infectious.
Yeah, I think as you get it becomes infectious in being around people that are service oriented.
Oh yeah.
I say this all the time. I mean, we're blessed to be around people in the Veterans Health Administration that are focused on service to others, and they're serving people that are also focused on service to others. It's amazingly rewarding to be involved with so many great people that do this.
And I'm glad you brought that up, Chief, because I tell you, John, that I have been exposed now through the work that I'm doing in this whole health office, the Office of Patient-Centered Care and Cultural Transformation, people like Dr. Ben Kliegler, who have taken on that same passion, many of whom have not been in uniform, but who understand, and in many respects humble me in their passion and their commitment and their work ethic. And I've been one who has been doing that as a career. I'm very, very impressed. I'm very impressed with that. Just as I would with reservists and National Guardsmen.
Yes.
I felt so blessed that I was an active duty soldier the whole time I was in uniform, and not having to run a business or do a practice. Rich Stone himself was a dermatologist the whole time he served as my deputy surgeon general, and I just couldn't believe they could do that and split their efforts as effectively as they have. But without them, we could not defend this country.
Yeah, and with the sacrifices that they did of giving up a practice to go serve in Iraq and hospital, seeing patients with their specialty.
Well, yeah.
That Army medicine may not have had the ability to have.
At one time early since much of the Army especially came out of the Southeast, and I had responsibility for that, at one point almost a majority of the leaders within our hospital at Eisenhower Medical Center at Fort Gordon were activated reservists, backfilling people who had been deployed.
Right. So you dedicated your life really in both to the military as well as veterans, and maybe you could describe your career path a little bit more in depth of how you first got into medicine. You come from a military family, but how did you first get into medicine, and what led you eventually to the military?
Well, I had to give an oral history at one point about my career, and I said, when you're in a family of 4 boys, as I was with an active duty father moving all the time, went to 4 different high schools and 4 different elementary schools growing up. And you're all about 2 years apart. You have to figure out what you're going to do that's different than the other one. My older brother was a terrific athlete. My younger brothers were, one's a natural salesman, one's a oil geologist, and all very bright and proficient in their own way. So my path that I chose was more in the science and academic realm. And when I went to undergraduate school, I joined the ROTC in part because, let's be honest, military families are not the wealthiest, and my dad was no exception to that, with 4 boys going to be coming out quickly. So we did everything within our power to help with that, working extra jobs and joining the ROTC. We also had a tradition in the family of service, regardless, in some fashion, national service in some fashion, and. So I started working in various jobs, and one of them was working in a hospital. And and my mom was a biology teacher. I was already oriented to that. Really was captivated by medicine at the time. This is at a time right before the invention of electricity and antibiotics, so it was a different era in medicine. I joke with folks, but I've never looked back. I started working in hospitals at about the age of 17, and I haven't gotten out of them since. My interest as a medical student turned to more research. I became intrigued with blood disorders, and specifically sickle cell disease. Did a PhD along the way while I was doing my MD. I interspersed a PhD program in human genetics. And then when I got out, the Army, by that time, and believe it or not, in 1970, when I was commissioned, had all the lieutenants they needed. And many of your former enlisted vets would say they never needed lieutenants.
I would never say that, sir.
But so they said, go find something to do while we program where you come in. And so I went to medical school. Then graduate school and a residency and a fellowship in hematology and blood-related disorders. And at that point, the Army said, okay, we really need you back. And that was in the late 70s. So I came in the Army and served as a researcher for a short time, and then went to Walter Reed as a clinician and as a teacher of younger docs. Did that for a number of times. Met my wife, who's is now a health coach, actually, a wellness coach and a yoga therapist. And she was an Army nurse at the time. She said, this is not why I came in the Army. She's an ROTC grad herself out of Boston College, and said, I want to see the world.
Right.
I don't want to just see the wards of Walter Reed, at midnight. So we went to Europe, and from Europe I started seeing, and I'm sure your job, you had similar things, I started to see healthcare and health in general in a different way. At that time we had 1 million beneficiaries. A lot of people don't remember this. I mean, as we're going through this in Afghanistan and elsewhere, we had over 1 million beneficiaries of military healthcare, 250,000 soldiers, sailors, and airmen and their families. In the Army alone, we had 65 health clinics and 11 hospitals in Germany.
Wow.
And Italy. Yeah. So, but I began to see healthcare and medicine from a different perspective. Went back, took an assignment again as an academic, but realized that once you see whole populations, what you can see to help the Army and to help populations and families in their health and well-being, it's very hard to go back down and do tactical level bedside medicine, even though I kept a little bit of that going all the time. And was privileged then to be selected for command and special schooling that the military gives us, and was actually in Europe in command of a medical brigade in Europe when the Pentagon and the World Trade Center and the Flight 93 were attacked. We changed our entire focus again away from where we were focusing at the time to the Mideast. And just about the time my brigade went, they promoted me to general officer and brought me back to the United States. And I've been doing jobs within the United States since, to include running our medical research command up at Fort Detrick, Maryland, where we have a worldwide network of laboratories, some of which develop vaccines, as you may know. And then was called in 2007 when we were having difficulty at Walter Reed to kind of command Walter Reed and try to put things back together. And that was another very intensive relationship with the VA, because we had to figure out a lot of what our soldiers and their families were experiencing, soldiers, sailors, airmen, Marines, Coast Guardsmen were experiencing, was a difficulty in the handoff between the DOD and the VA.
Right.
And so we worked very closely with the VA in trying to develop this transitional program that continues to evolve, even as new veterans come in. And then was selected to be the Surgeon General and the commander of the medical command. When I got out, as I said, I went to the Uniformed Services University as an academic, and have been working there ever since.
Well, you mentioned a little bit about the transitioning soldiers and sailors, airmen, Marines, and we continue those kind of programs in whole health and how that reaches them. And maybe I shouldn't say whole health program. You've been very clear, but
Yeah,
it encompasses much more than that. But
yeah.
Maybe talk about your own whole health journey and kind of what you do or have, I guess, learned to do.
Well, very good question, and I have to admit that I was one of those healthcare providers and physicians and then later leaders who in the old ads would have been smoking a cigarette while you're telling your patients to quit smoking.
Yeah.
So, I'm working 20 to 21 hours a day and sleeping 3 hours a night, even though we know that is dangerous and not good. Not looking for ways to restore myself, nutritionally not very sound and the like. But the Army really helped me quite a bit. I go back to the fact that the first time I ever ran more than about one lap around a track coming out of high school was when the Army told me I was going to run a 1.5 mile run. In those days, we ran a 1.5 mile run. And I looked at these guys in the ROTC program. I said, "What are you talking about? Human beings aren't designed to run 1.5 miles." And the Army said, "But they may not have been, but you're going to do it, by God." And I became pretty much a religious runner after that. I ran marathons. In fact, my wife, who was a former college runner, long distance runner herself, and many of our earliest dates were in long runs in and around the DC area and elsewhere. So that became a lot of my focus. But since I've aged, what I've learned is it's not about doing the same thing all the time and for your whole life. It's about finding things that you can keep engaged with, that you enjoy doing, but also contribute to your mental well-being and your fitness. And so hiking has been a part of our program of individual health, and this notion of meditative mindfulness has helped. I do some yoga. Living with a yoga instructor, I've learned a lot about yoga. I've learned a lot. In fact, one of the things we've learned, and I credit my wife with helping with this, is that these programs that we have in complementary practices, such as yoga and acupuncture and music therapy and chiropractic and medical massage, are very effective in pain. She was suffering from a chronic low back pain, and this is not a HIPAA violation. She shares this openly, and it was really through her efforts to remain active and to remain well in her own life that she began to experiment with other things. When we went to Europe on our last tour of Europe, she went to a German acupuncturist, came back and said, "You know what? I feel better than I've felt in 25 years. And I kind of looked at her, and I remember acupuncture from the 60s when President Nixon went to China, and one of the leading journalists at the time, James Reston, had an operation under acupuncture and wrote an editorial in the New York Times.
Wow.
And I was in medical school, and it just riveted us. So many of us started looking at that, but it wasn't mainstream. Now, 30 years later, I'm looking at my wife getting better and better and better, doing yoga, doing acupuncture. And so as a Surgeon General, I started asking people, rather than relying on psychotropics and opioids, let's explore what's the science behind these complementary practices that we've got. And we put a team together. That team came back, Dr. Trip Buckenmeyer and both Trip and Kevin Galloway, former career naval nurse corps officer in the Army, and said, sir, our team has been brought together. We've tapped into the VA, which has been doing this for some time now. We've gone into the private sector and the academics, and you're absolutely right. The science behind these practices is as good, if not better, than what is there for a lot of the instrumentation, a lot of the procedures, and certainly for opioids. You know, Chief, there's not a single study in chronic pain for chronic use of opioids that shows effectiveness. Not a one. And yet we've contributed now to a devastating opioid addiction problem in this country by getting people, onto opioids. And fortunately, the VA, under people like Dr. Friedhelm Sandbrink at the Washington VA, who are leading in this, are turning the corner on that, are inserting opioid safety programs at the same time that we're promoting a whole panoply of individually tailored programs for people. So that has become a major focus, and again, one of the ways that I got interested in whole health, because these practices are potentially tailored to individual veterans who have a whole panoply of needs.
Yeah, and I think that you describe a little bit about how it's transformed the VA itself through whole health. And so maybe you can talk a little bit about that whole health transformation. You mentioned a little bit of how you kind of came to it as a Surgeon General, but in the VA, how did that transformation kind of take hold? And Tracy is a good friend and hero of mine, and I know she kind of was really the first one to make me aware of it. But so kind of from your perspective, how has it kind of taken over in the VA? Or how is it going to take over in the future, I guess is also important.
Well, I think the first thing that has to happen, and the reason this is called a transformation, an entire systems transformation, is because it has to involve every element, starting with the individual beneficiary. And I'm working very hard to call the centerpiece of this the veteran, the beneficiary, and not the patient. Much of our effort is to keep people from becoming patients.
Right. Good point.
Or if they're patients, to focus as much on other aspects of their life as they do on their patienthood, so to speak. So it has to involve everybody who's in support of that veteran and the veteran's family and the community in which they're working. And so working, living, playing, whatever it might be. So it starts with the individual veteran. It starts with a veteran at transition from active duty to say to themselves, okay, I'm taking off the uniform. You remember when you were a kid and you had a class that you hated, and you couldn't wait until you were through with it, maybe even in college, and you took the book at the end and you threw it away or you tore it up or
I'm really done.
You burned it in the fireplace. And there's some of that thought process when you get out of uniform. Okay, everything, all of this is behind me. I'm going to burn the uniform. I'm going to get rid of all this stuff. I got my shadow box, and that's going to be it. Well, guess what? You were taught, and you incorporated some very critical lessons about your life while you were in uniform. Those aren't to be forgotten. So at that transition, I think the VA re-energizes and revalidates that through their transitional programs. And there are a couple of them. One is the military to civilian ready program that's run by the Veterans Benefits Administration principally. But at transition, what we're looking to do is to exploit all of the skills and orientation that the new veteran has, and then welcome them in by presenting them with a set of pivotal questions. What's meaningful to you? What is the status of your health and your comprehensive well-being right now? And what path, what journey do you have to set out on to achieve what your new goals are as an individual? Just as I had to do. When I sat back as a retiree, and you did too, and you started seeing a retirement check come in, and nobody was calling you at 4 o'clock in the morning.
Midnight,
and suddenly your life is yours. And so it starts with the veteran. It extends to that veteran's colleagues and peers who can be assistants in this. We have a whole network of peer advisors in that regard. And with all of the programs that then can be put together to assist the veteran. And some of them are better established right now than others. And I'll go back to the healthcare side. We know, for example, and some of the achievements that the whole health program system has already achieved is in this realm of pain. We know from the first 18 VA flagship sites over the first 2 years or so that veterans who've taken advantage of the whole health program, starting with their own definition of what their health and well-being is, not my definition. Mm-hmm. I can't anticipate what is meaningful and of importance to you in terms of your health and well-being, but in terms of their own construct. If pain is a part of that, and you take advantage of some of our assistance in classes, in online education and training, in self-care of your own behaviors and the like, and then take advantage of some of the practices that we've got available to you that appeal to you. Try yoga. Mm-hmm. If you've got chronic low back pain, if you've got cervical, that is neck pain, enroll in a Tai Chi class. You think Tai Chi is kind of a spooky little thing that big crowds of Chinese do when you get online? Go try it yourself. Mm-hmm. I don't know if you've ever done Tai Chi. Yeah. I tell you, you can feel that the next day. Yeah. And we know that programs like that are very, very helpful for certain categories of pain. This whole idea of mindfulness, that was discovered through the work of John Kabat-Zinn up at the University of Massachusetts probably 35 years ago, when he realized that in teaching people stress reduction through his mindfulness-based stress reduction program, they also got better with their pain, because their pain didn't become something that possessed them, right, that they defined their whole life by being mindful of the moment. And by not avoiding the pain, but actually turning into it and looking at it directly, they were able to reduce the level of pain and discomfort and disability as a function of that. So it starts with the individual veteran, grows through their peer assistance, then into programs that we conduct, and then individual professions. If part of what is hassling you at this moment, if part of one of your obstructions and obstacles are persistent, mental health issues that you have, if you're haunted by dreams, if you have problems with sleep that are leading you to start using, the soldier's long-standing sleep assistant, alcohol, if that's what you're doing, we've got programs for you that can move those thoughts, move those intrusive thoughts, move those avoidance behaviors into a space where you can manage it far better and you aren't controlled by them. All of these things are available to you, but I can't tell you what you need. You have to help us by telling us what's going to be important to you.
I think you mentioned earlier the recent events in Afghanistan have really shown to me, and I think to a lot of people and veterans, obviously, the necessity for a whole health model. But if there's a veteran watching that says, that's appealing, I want to learn more about Tai Chi or how I can get into mindfulness or yoga at my VA, how do they do that? Through their primary care provider or just outreach?
Well, first of all, the internet is a tremendous tool and powerful. The available assets on the internet right now around whole health are substantial, and that individual, I can tell you, if you're out there listening to us and you want to know, go to Veteran Whole Health. Just put that in there. Put VA Whole Health, whatever it might be, and you'll come to a website on whole health that explain the whole concept. You'll see an image in which you're at the center of it, and all of what I've been describing is around that to help support you. And there are a whole bunch of links there, starting with that notion of how do I do an inventory of my own health? How do I start thinking about the journey that I'm about to launch on? And then what programs are available out there? If you don't have access to that, or that doesn't appeal to you, your local VA facility will have whole health trained individuals who are the AWACS, that are the air traffic controllers that help engage with you and help sort out what's important to you and how you can go about doing that.
Wow, fantastic. So what do you think is the future of whole health in the VA, not only in the VA system, but in the military system, but even more importantly, maybe how does it get really inculcated into the rest of healthcare in America?
Well, and health promotion in America. I honestly think, and the reason this was so attractive to me, both when I was in uniform, because we've tried various versions of this ourselves in uniform, but have so many other things that are going on while we're in uniform. What's always occurred to me is that this is a fundamental transformation that can help the entire U.S. in its struggles right now with the balance of health and healthcare. Hey, if nothing else, Chief, this pandemic has demonstrated the gross disparities in health equities within the country.
Yes.
And access to health.
Yes.
Racial disparities in access to care, ethnic, gender disparities. And one of the big goals of the whole health system is to reverse and to correct those disparities, to encourage access for a diverse group of veterans and their families, to ensure equity in access to care. So the whole system in the United States is struggling with this. We have an unaffordable system, an unsustainable, expensive system that, quite honestly, is not helping everybody to the same degree that it could, and in some cases is even harming them. And I think I see what the VA is doing, and hopefully the military, as being scouts out for the whole system of health and healthcare in the country, to put the emphasis back where it needs to be on the individual's aspiration for their health and well-being, and to make their lives as meaningful as possible by overcoming whatever obstacles might be out there and enhancing the skills and strengths that they have as individuals. So I see this as really transformative, not just for the VA, but for everyone. And I commend every clinician out there, every nurse, every social worker, whatever it might be, who may have been trained or educated or has practiced in a different kind of a system, for their embracing this whole health concept and being a facilitator for how this is working. That the first doc that a veteran encounters who just rolls his eyes or her eyes and turns up his nose at this is going to cut the legs out from under this. But they haven't done that. They've embraced this enthusiastically, and I think that's real important. And they need to see themselves as vanguards for, I believe, a national transformation.
I think you mentioned some really great things, but I think it gets back to trying to avoid becoming a patient to start with. And so we've come to the end of our time, and I could continue this conversation for quite a long time. It's very, very interesting. And then so I've really picked up a lot of great things out of it. I live in the moment, think that's really key, and as well as why it's so important to do what we're doing. And so I'd like to turn it over to you for any kind of closing thoughts or comments that you wanted to offer.
Well, again, let me close with how I started, just with gratitude for what you provided me as a forum here, and for my colleagues in the Office of Patient-Centered Care and Cultural Transformation for what they're doing, and for their arming me with this. I'm a conventionally trained reductionist physician who has been transformed in his own life by these notions that we've been talking about, and I encourage everyone of both the VA employees as well as the veterans who come into our system and their families to look carefully at this system and this transformative effort that's taking place in whole health. And I want to close by also saying to thank everybody for their service. I mean, I remained in uniform, and I remain as a member of this community because of the important work that I've seen the U.S. military do throughout my life and throughout the world. And the contributions that we've made and continue to make, I think, are substantial, for which we all can be proud, and for those things that we can learn from, we learn. Thank you so much, Chief.
General Schumacher, thank you so much for taking time to be with us, and thank you for your service, and thank you for joining us. I hope you enjoyed today's conversation. A huge thank you to all of you for listening, to Dr. Schumacher for his time, and our broadcast and production team for their support. See you next time.